Hi, my name is Haley and I'm going to be demonstrating trach suction and care today. So the first thing I'm going to do is gather my equipment up on a bedside table and I'm going to perform hand hygiene. Then I'm going to identify my patient and make sure that I provide privacy for the patient. And then I'm going to describe the procedure to the patient, what I'm going to be doing. I'll also make sure that the bed is in a comfortable working height and then I place the patient in high Fowler's position. Then I am going to place a Trach on my patient. Okay, and then I'm going to put on clean gloves. And I'm going to make sure that I turn suction on to the highest setting. And I'm going to test the suction, make sure that it's working, and I'm also going to make sure that I have an ambu bag in place to provide hyperventilation for my patient. And then next I am going to remove my clean gloves, perform hand hygiene, and I'm going to open up my sterile suction kit. I'm going to place my sterile gloves aside and I'm going to open up my little cup without touching the inside, place that to the side, and then I would grab my saline, making sure that my hand covers the label, and since it has been used I would lip it in a garbage can and then fill up my little cup with the saline. And then next I'm going to apply my sterile gloves. Okay, so once those are on, I will discard the packaging. And then the next thing I am going to do is I'm going to open up the catheter tubing. And I'm going to coil it up in my hand. Okay. Then with my non-dominant hand, I'm going to take the suction tubing and connect it. And then after that, I'm going to test the suctioning with my normal saline. And then I am going to remove my patient's oxygen and hyperventilate my patient, giving them 4 to 6 breaths. Okay, and then once my patient is hyperventilated, I'm going to hold my trach plate in place and insert the catheter, slowly rotate it while including the suction, moving it around no more than I think 3 to 4 seconds, and I'm going to remove it. Then I'm going to make sure to apply my patient's oxygen back. And then I would ask my patient if they feel more clear. If they did, I would only have to do 1 round, but I could do up to 3, making sure that I hyperventilate my patient in between each one of the suctionings. So now I'm going to remove the catheter, place that in there, and then I'm also going to take my patient's dressing, remove that, and then I would also grab an assistant to hold the trach in place. I possibly can do that. So I would hold that in place with my non-dominant hand and remove that. And then I would discard, making sure that I place my patient back on their oxygen. I would discard of all of that along with my sterile gloves. And perform hand hygiene. And then next I will be doing the trach care. So I would open the cleaning tray, making sure to only touch the outside. I would remove the sterile gloves. Okay, so once I have my sterile gloves on and I poured new saline into my container, I am going to take the Q-tip applicator and dip it in the normal saline. I'm going to remove this and clean behind the plate while holding it in place with one swipe. Discard that, take another, do underneath. Okay. Then at this time, since the cannula was interchangeable, I would hold the plate in place and insert the new one. And then I would also put the new dressing on. While holding the plate in place. And then I would reapply the oxygen on my patient. And then at this time, I would grab an assistant to help me interchange the neck band on my patient. And once that's completed, I would take my sterile gloves off, discard all my supplies, perform hand hygiene. I would place my patient back into a comfortable position, and that's it.